First of all, like good afternoon, good morning, good evening from everyone from around the world. And my name is Erdem Yörük. I'm a sociologist. I teach at Koç University, and I am this year a visiting professor in the Social Policy and Intervention Department of University of Oxford. And I've been trying to work on like social welfare and politics in general in the global south. So, and I'm one of the co-organizers of this seminar series together with Philip and Dorothea. And Dorothea, she's now flying to Ann Arbor for an event. And so I'm here to like moderate the talk. And the talk today's event is part of the global a seminar series on development and democracy and welfare, democracy, autocracy, and the welfare state in the 21st century. And today's talk fits the broader agenda of this seminar series perfectly. And I would like to thank our participants a lot. And today's presentation's title is Social Policy Development in Authoritarian, Semi-Authoritarian, and Democratic Regimes, Comparing Long-Term Care Systems in China, Hong Kong, and Taiwan. This is a fascinating and highly timely topic. Not only because long-term care has become one of the central challenges of contemporary social policy, but also because the paper and the talk will invite us to think comparatively about how different political regimes shape welfare development. And we are like pleased to have with us today Professor Daniel Béland. His work has been enormously influential in the fields of social policy, comparative politics, and the welfare state research. And so his scholarship has helped shape how we think about the politics of welfare institutions, policy development, state transformation. And we are also delighted to welcome Professor Juan Shi, excuse me for my wrong pronunciation, from National Taiwan University, whose work has as well made major contributions to the comparative study of welfare states, especially East Asian social policy and the political development of social protection in general. And last but not least, we are very honored to welcome Professor Chan Wing Kit from the School of Government and the Center for Chinese Public Administration Research at Sun Yat-sen University. His work brings important expertise on governance, public administration in the Chinese context. So please join me welcoming three leading figures from around the world in social policy, and I want to thank you a lot for taking your time for both presenting and listening to this talk. Thank you.
Thank you very much. Good morning, good afternoon, good evening, good night, depending on where you're located. Jacques and Sinjun are, of course, in East Asia, in Taiwan and mainland China, respectively. So for them, it's late evening already. For me in Montreal, it's 10 a.m. We are in the middle of a nice storm here, quite exciting. And I'm really glad, of course, to work with my two friends on this project. I think it's very timely. And I will now share the slides, and hopefully it will work properly. Oh, I have two different versions here. Doot, doot, doot. Normally, you should be able to see the slides. Do you see them? Yes, very good. Okay. But now I have a little technical problem here because I can't move them. Oops. Okay. Um, hmm. Okay. I will go at the beginning. That would make more sense. Yes. So, why did we decide to write this paper? This is a very early draft with the version that was circulated. It's not the final draft, obviously. It's rather short and incomplete, but that gives you an idea of where we are going. And the title itself will probably change too. But we decided to do this paper to write this paper because we are interested in how political regimes, political institutions in general, but especially regime type, might affect the politics of social policy. And here we have three very interesting cases. Now we have three societies within the Greater China, so societies that have a lot in common in terms of culture, language, history, societies that have a lot in common demographically, as we'll soon say. These are rapidly aging societies. So societies that have a lot in common, but they differ uh, quite dramatically in terms of their political regime and the nature of their political institutions. So we have mainland China. Mainland China is an authoritarian regime. That's pretty clear. And the second case that we have at the other end of the spectrum, in a way, is Taiwan. Taiwan is a democratic regime, and it's a country where there is no significant democratic backsliding. While Hong Kong, in the middle, in a way, is a country, is a jurisdiction, a society. It's not a country, right? A society in which you have a shift. Let's say it's a democratic regime that's becoming increasingly authoritarian, or it's witnessing the language we'll use, some people here will use, is it's facing democratic backsliding in a quite rapid way. And so we can say it's semi-authoritarian now by this stage, and it's really in flux. So we have a stable authoritarian regime, a stable democratic regime, Taiwan, and then in the middle you have Hong Kong, which is pretty much in flux but sliding from in terms of the political regime becoming less and less democratic. And so we are trying to study the consequences of that, of these, let's say, macro political institutions, and especially how they shape relationship between state and civil society actors. And we're trying to see how these different relationships between state and civil society actors, state and society, are affecting the development of long-term care policies in these three societies, mainland China, Hong Kong, and in Taiwan. So we will start by talking a bit about the demographic reality. We are talking about long-term care because it's a huge issue in these societies. These are societies that have very low, all of them have very low fertility rates, among the lowest in the world. And they are confronted with the policy challenges that all rapidly aging societies are facing. And so that explains also why we decided to focus on long-term care as the case to gauge the impact of political regimes and institutions on social policy. Then we talk about the political regimes, institutions, and policy legacies in these three societies. And then we will discuss the three cases one after the other before concluding. So let's look a bit at the demographics in terms of these three Chinese societies. You can see here, of course, we've seen already witness a rapid increase, gradual but still significant increase in terms of the percentage of the population age 65 and older. Here it's especially, I think, clear in Hong Kong and to a lesser extent in Taiwan, but it's becoming also increasingly significant in mainland China, although it's not as dramatic. But of course, in future decades, it will get, mainland China, considering the current demographics, this proportion will keep increasing. Now, when we look at fertility rates, I mean, what I just said, we've seen major changes in these societies, especially in mainland China. But you look at fertility rates now, in Hong Kong, we talk about fertility rate of, 0.8, that is extremely low. it's lower than even countries like Italy, and some Southern European countries that have very low fertility rate, like Italy and Spain. This is lower than that. And we see Taiwan is also very low, again around zero point 0.8. And then when you look at actually lower than that, yes, 0.7 in Hong Kong, zero point 0.8. That would be zero point 0.8 child per woman on average, right? And mainland China at 1.1 is still very low, right? And you saw the drop in China is quite sharp. In the other jurisdictions, the recent drop is maybe not as dramatic, but it's there. So obviously this is creating major challenges in terms of pensions, in terms of long-term care, and other aging-related social policies. Um, so, so we are talking here about super age societies, right? And this is happening quite rapidly, and you see, the numbers here in China. You had 7% of people aged 65 and older in 2000, and now we are in 2023 we're at 14%. And you see in these other societies, Hong Kong and Taiwan, they are ahead of the curve in a way in terms of population aging compared to mainland China. But still, this is happening rapidly in China. In mainland China, took only 23 years to jump from to double the percentage of people aged 65 and older. Took 30 years in Hong Kong and 25 years in Taiwan. So things are happening really rapidly. And from 14 to 20%, we see it's accelerating. And we are talking at, a period of 7 to 12 years, depending on the country, to increase again really significantly by almost 50% the rate of population above 65. So really fascinating data. And it's the background of what we are studying, because we are studying the politics of long-term care in these three Chinese societies. So the research questions that we put forward are: what is the institutional logic that underpins the introduction of the long-term care policy in the Chinese societies with different political institutions and regime, democracy versus authoritarianism, and in the case of Hong Kong, I would say now semi-authoritarianism? What paths have the societies with different political institutions been striding on? And what policy implications emerge from the care provision? So we are not just interested in the politics of things, or we are social policy scholars, so we are interested also in the actual policies and how they are changing, why they are changing, and what's the impact of that over time. Now we move to the type of political institutions. I already discussed that very briefly, comparing these three societies. Our starting point is really historical institutionalism. We focus on the polity, like the political system, to paraphrase T-Cockpol, and we explore our institutional configurations of governments and political party systems impact the development of social policy. We emphasize a lot the relationship between state and civil society, which is what a lot of historical institutionalist scholars like T-Cockpol have done. And this is something that can be, I think, easily a framework that can travel really well. It can be adapted to study countries in different parts of the world, even if this framework was really developed first in the United States and in Western Europe. So the importance of civil society interaction that are institutionalized over time are really important. We are interested in different constellations of interest and actors, state and non-state actors, especially bureaucrats and civil society actors, both individuals and collective actors, so organizations. So with Xi Jun and Carmen Ho and others, we published an article in 2023 that compares China and India to study the impact of democratic versus authoritarian regimes on social policy development. And we draw on this contrast between these two types of regime as the starting point of our analysis. Of course, in that paper, we had two very different cases, India and China. One of them, of course, a democracy, the other one, an authoritarian regime. But I think the case selection here that we have now is that we have three very similar societies, culturally and demographically and economically. But the divergence is really the main divergence in terms of the regime type and political institutions. So these most similar cases within comparative politics are very helpful, I think, to tease out the importance of political institutions in terms of shaping the development of social programs. In our case, long-term care policies in these three Chinese societies. So here we see, of course, China as authoritarian, Taiwan as democratic, and Hong Kong as a hybrid in-between regime that we can call semi-democratic or semi-authoritarian, I suppose, but that is really facing democratic backsliding, which is not the case of Taiwan. And of course, in the case of China, there is no, it's not a democracy, so you cannot talk about democratic backsliding. So I will now let Jack to be no, sorry, yes. So I already discussed that. You know, the different regimes and how they work, their differences. Clearly, China is there is the political monopoly of the Communist Party. There is a high level of state capacity, but a lot of regional disparities. I mean, a difference in addition to the difference in political regime type and political institutions. Mainland China is much, much bigger than Hong Kong and Taiwan, right? So regional variation is important here. Then Taiwan and Hong Kong, we have really strong democratic party competition within Taiwan. Again, a resilient democracy. Hong Kong, you have importance of bureaucrats like in China, but there is NGO participation in policy making, but now it's being increasingly constrained by bureaucratic supervision under a system that is, drifting, that is becoming less and less democratic. So again, three interesting cases, contrasted cases from an institutional standpoint, and they are also moving, in terms of Hong Kong, it's moving from one regime type to another, while Taiwan and China, for the time being, are quite stable from an institutional standpoint. So these are my general remarks about the cases and case selection. And now we will move to Jack, who will tell us about the situation in terms of long-term care development in mainland China. Jack, it's all yours.
Hi. Hello, everybody. I will take over for this section. So before I talk about the case of China, there is a very brief background to talk about, very important, that the contemporary social security system in China is very much rely on social insurance. That is a policy learning process between Japan, Korea, and China. So, well, in terms of long-term care insurance, we all know that Japan introduced it in the year 2000, and then Korea introduced it in the year 2008. And that was a very important background that the Chinese leader and the scholars who are researching on Asian society were actually pushing the agenda that when is China going to do something similar? And that was a very important background in 2010s when we were talking about the emergence of long-term care insurance in China. So in the year 2012, that was the first local experimentation took place in a city called Qingdao. That what happened in Qingdao actually in the year 2012? Actually, Qingdao was a very interesting place located in Shandong province, well, it's a place for tourists actually, and also they have some local industry as well. So Qingdao has a larger proportion of its population who are the so-called employees in the Chinese sense, rather than the other social group, we call them residents. So, well, because when we talk about the social insurance in China, there are only two categories, employees and residents. So in Qingdao, they have more employees than residents. In the year 2012, they witnessed a problem that so many elderly were actually occupying the beds in the hospitals and using their health insurance to pay for their beds, despite the fact that they are not sick. They were not sick. They were not suffering from illness. They were only suffering from disability. But they rather stay in a bed in the hospital than going into a nursing home, because a nursing home would charge them the fees that is totally relying on themselves. That because it was self-financed for nursing home. However, beds in the hospital were partially, well, actually 70% roughly, could be reimbursed by the health insurance. So they got that problem. So they developed a mechanism, giving the example of Japan and Korea, to tackle that. That is the local policy implementation of the first long-term care insurance in China. So they try to channel the elderly in the hospital to nursing home, given the fact that they establish a mechanism to reimburse the fees in nursing home as well. So the elderly who are suffering from disability, they did not stay in the hospital anymore. They went to the nursing home. So I think that was very illustrative for the reform path afterwards. So the Chinese government introduced a national policy experimentation in the year 2016, roughly based on a similar logic. They tried to make going to the private beds in nursing home reimbursable for the employees, so that fewer elderly employees suffering from disability would stay on the beds in the hospitals. The mechanism actually were mainly targeting those urban employees. And there was a key issue that where was the money from? Because this is reducing the burden of the health sector. So that served as a perfect justification for channeling some of the healthcare insurance money to finance that. So actually, for the first phase of that policy experimentation, the Chinese government was instructing those 15 cities selected for that policy instrument to use the so-called health insurance surplus, the money they left every year after all the reimbursement, to pay for the future years reimbursement for long-term care. So that's what we call the surplus for healthcare insurance, channeling the surplus from healthcare insurance to finance long-term care insurance. So that was the first phase. And then from the year 2020, that the Chinese government introduced the second phase. However, the year 2020, well, we all know that China was unexpectedly need to face the challenge posed by the COVID-19. So the Chinese government was very cautious on spending too much to cover too many people, so that they could not control the situation. So they introduced a new a national policy for another 40 cities to add to the list. So total 29 cities plus 2 provinces. They instructed all the cities that are implementing this policy experimentation to tighten their budget and to make sure that only the very severe disabled were covered. And if you cannot afford, you don't cover the medium level or the very light level disabled elderly. And more importantly, that the structure of that second phase well, when we look at that, we need to know that there is a central level and a local level. The central level, that actually the government offer an umbrella policy that only provide the key bones of the whole structure. As to the details of the policy measures, they allow the local government to muddling through with limited authority. So eventually, China ended up with more than 40 or 50 cities with more than 10 models implementing long-term care insurance. So let's go to the next slide. Daniel, let's go to the next slide.
Yeah, I'm
Daniel,
trying to switch. I don't know. Yeah,
okay.
I'm not sure what's happening with the system.
Okay.
Aha! Okay.
Wow, great. So to sum up these two phases of reform in China in the past nearly 10 years, now it's a decade of policy implementation. The Chinese government was still not very confident in rolling out the policy nationwide because of a few issues. The first thing I think is the local developmentalism, as we listed here. Well, they actually consists of a few issues. Firstly, is about where was the money from and where will be the money from? Well, I mean, those cities that were chosen for pilot schemes in the past two phases were mostly provincial cities or coastal cities who has the surplus to finance long-term care without increasing the contribution rate of social insurance. That was a very important point. However, when the central government wanted to roll out the whole policy, there was a huge challenge for many other cities that did not have the surplus of their health insurance, and they were not able to use their local finance to subsidize long-term care insurance either. So that was a very big problem. However, when we look back, so in the past two phases, it was those 40 or 50 cities that already implemented long-term care insurance. They are local leaders. They were they got a very strong incentive to do that because we need to know that in an authoritarian regime like China, that the mayor, they do not seek votes from the local citizens. They seek approval from their line manager. So to demonstrate they are doing very good is a very important incentive. So this is something we need to we need to know about the issue. So the second thing regarding the long-term care insurance policy experimentation is the sectoral fragmentation. So if we talk to people from Japan or Korea, that they got one single government agency to handle the long-term care reform. However, if you come to China to talk about that, you can see that you will face more than 4 government agencies that are directly or indirectly in charge of the reform. Say that we all know that it is the National Health Security Authority, or at national level, we call them the Medical Security Bureau. They in charge of the long-term care insurance, how to pay for that. However, all the nursing homes, all the social organizations who provide the service, they were actually administrated by the civil affairs. And as to the hospitals and the clinics, they were actually administrated by the healthcare committee. So you can see that it's quite fragmented. If China is unable to merge these government agency into one, there will be a huge challenges in the future how to push this forward. So this is a critical issue here we need to face. And why China cannot do that? Why China cannot do that? Well, so there are many factors. I do not have time to elaborate, but one thing very interesting is that the more you need to know about China is the more government agency we have, the more positions we can offer to the to the people in the establishment. The fewer the government agency, we have fewer places for them. So this is one critical challenge we are facing at the moment. Okay, there are a few things that we are facing at the moment. The service imbalance between institutional care and home care, I think that has everything to do with the topic we are talking about, because that we are talking about how NGO, how the third sector can influence policy making. Here we can see that in China, that the whole long-term care reform were actually relying heavily on institutional care, on nursing homes, rather than on home care. One of the critical issues is that we don't really have a vibrant third sector who can provide that many services needed, demanded by the elderly. I mean, we can look at the case later about Taiwan. You can see that how a vibrant third sector can do. So that will serve as a big contrast. And the last thing is also related to that is the family caregivers are completely left out. They are not covered by the reform at all. Well, I mean, this is a big contrast to Taiwan as well, because the need assessment for long-term care system now in Taiwan is not only conducted for the people who need the care, but also conducted for the people, for the family caregiver who provide care. But in China, the whole policy did not mention family caregiver at all. So I think this is something very interesting about China. So okay, so let's move on to the next slide. Well, to sum up about the policy making in a society like China, which is authoritarian, so I think we need to know about the top-down decision-making characteristics with the bureaucratic competition in China. So Daniel, we need to move to the next slide.
I'm trying. I don't know what's happening.
So yeah, no problem.
I will stop sharing and try to fix it. You keep speaking.
Okay. Yeah. The authoritarian policy, the authoritarian polity in China, there are a few key features or characteristics I want to mention. The first thing is that the fragmented government. The fragmented government, in many ways, that the first thing is that you remember that the four agencies dealing with one issue instead of one agency dealing with it. So this is, I would say that this is vertically. And another thing is horizontally, where the central government overlook the framework of the policy, but allowing the local governments across regions to have different version of the policy. So this is hugely fragmented reform in an authoritarian regime. We might think that an authoritarian regime might be very powerful top-down model, but currently that it is problematic domestically in China. Well, another thing we need to know is about urban employee prioritize. This is a key feature of the long-term care reform in China. So why it matters in our research? So if we look back to many social policy reform took place in Taiwan or Korea in 1980s during the democratization period of time, you could see that they always prioritize the military veterans, the public servants, and the teachers working for the public schools. So say that public sector employees. So to some extent in China, that well, we have two categories. That one category is employees, another category is residents for social insurance. So most people working all people working for the public sector, they are all urban employees for the first category. And for those people working for the private sector, only those with a contract, they are actually working for, they would got only those with a full-time job, they would got a contract and as a result become an employee for that category. For the rest, those people working for the platform economy, they do not have a contract, they are all categorized as residents. So you can see that prioritizing urban employees actually is to some extent echoing what we saw in Korea and Taiwan in 1970s and early 1980s. So this is something I want to mention. And another thing is that the relationship between central government and local government, this is very tricky because that when we talk about how to finance long-term care insurance in China, we all know that the central government, they only pay the lip service, provide the policy, allowing the local government to do that, but they never spend a penny to subsidize the local government to do that. So it is totally up to the local government to figure out how to find the money to finance this new policy. So why the local government still want to do that? Well, I think a very important thing is that the central government is holding the personnel a power on who can be promoted. So this is a dynamic we need to understand. The last thing is about the NGOs. So as I mentioned earlier, that the NGOs, they did not play a role in policy making for this long-term care policy. Neither they play a very important role. Neither they play a visible role in providing care. So completely, actually, that the home care in China is currently totally provided by family caregivers and the market in the name of third sector. So when I say that, I want to let you know that so many care providers in China, they register with the government as NGO, but actually they operate in a way just like care companies. Well, because that to register as an NGO would have some kind of tax reduction. So that is the reason. So these are all the policy making details that we can see regarding the case of China. So I will pass on the case to Sejun for Taiwan.
Yeah, thank you, Jack. So before I go to the LTC policy development in Taiwan, let me give you some brief background of the Taiwanese case. First of all, Taiwan experienced democratization during the late 1980s. And nowadays, there are two major political parties, what we call the Nationalist Party and the Democratic Progressive Party. And so typically, just like the Western countries, there's a fierce political party competition, partisan politics in the Democratic Party in Taiwan. And so it matters which political party, is the ruling party. That's the first note. And also thanks to the democratization nowadays, when it comes to the state-society relations, yes, the NGOs have always play a very important role, in policy making process. Because all these major political parties would seek to solicit the major NGOs' opinions when making the policies. That's the second note. And finally, I also like to mention that yes, Daniel just mentioned the very fast trend of the population aging, but in fact, when it comes to the care provision, just like the mainland China and Hong Kong, Taiwan for a long time, the government has played a very minor role, in care provision. So actually, the care provision was mostly, borne by the individual families. And what's specific in the Taiwanese, care provision is that for a long time, long ago, Taiwan has already allowed, many migrant workers from abroad. So mostly from Southeast Asian countries. So nowadays, for example, despite the introduction of the LTC, we still have a large proportion of the migrant workers, foreign migrant workers, and they actually reside, live together with the families, with care need. So I like to, highlight these, specific characteristics in Taiwan. And so, as for the formal policy introduction, the government started the initiative in 2007. And here in Taiwan, we call it LTC 1.0 and 2.0. Now it's 3.0. Each phase consists of 10 years, so a decade. And so LTC 1.0 started in 2007. At that time, it was the nationalist, more conservative party that was ruling. At that time, this conservative ruling party was kind of learning from the German social insurance model. But basically, when it introduced the 10-year long-term care plan, the idea was, yes, first to establish a framework that would allow more people to get access to households to get access to the care provision. And also it set up at least a significant amount of the budget to provide the care. However, in Taiwan, similar to probably to mainland China and to Hong Kong, is that central government generally set up the framework, provides the that's different to mainland China. Central government provides the funding support, but then the local governments in Taiwan, it was the major implementation actor or agency. And so in the LTC 1.0, basically here, maybe I can move first to the next slide, Daniel, and then go back here. Because here I have a comparison between LTC 1 and 2. And so here I just like to show you that, the coverage. So at first, in LTC 1.0, you can see it's a limited proportion. Although, yes, it's the beginning. So it's limited to older people with functional disabilities, and mostly so aged above 65 and above. Yeah. And also people with disabilities, but then limited to those aged 50 and above. Yeah. But then to LTC 2.0, which was introduced in 2016, you can see it's also here coverage expansion now with more people with real care need. For example, people with dementia, and also some indigenous people with a younger age. For example, here you can see the difference between the different version or phases of the LTC in Taiwan. Basically, it's about the coverage expansion and also budgetary expansion, as well as service expansion. Daniel, please move back to the last slide. And the reason why the government introduced 2.0 was, of course, you can see that LTC 1.0 was quite preliminary. And so the budgetary extent was limited, and also the coverage was not that broad. Also, the service provision capacity was still quite limited. And therefore, in 2016, the second version of the LTC system was introduced. One thing to note is that in 2016, it was the other major political party that was in rule. So the Democratic Progressive Party, which is more progressive. at least in terms of the social policy, ideas. And here, however, there's a very radical change here taking place in that the now the ruling party, this another major social ruling political party changed the social insurance model. Initially, learned from the German model to a tax-based system. And so now it's still functioning as a fully tax-based system. And the idea actually was learning from the Nordic model because yes, I will introduce that ideational learning of the political elites later on. But when it comes to the implementation, so you can see the central government finance all expenses while the local governments implement the major operation. This is an idea also we learned from our neighbor, Japan, where the community care, or aging in place was really a very predominant idea prevailing in the system design. And so here in Taiwan, yes, the policy implementation basically took place in a three-layer way. So ABC network, what we call it. So you can imagine that A actually refers to like a city, while B to community, and C to maybe lower grassroots level communities, for example. And so it's a kind of layered service provision trying to offer accessible care service to those in need. Yeah. Okay, so Daniel, please go to next slide. Yeah. Next. And now, so last year, now Taiwan still has the Progressive Party. Sorry, maybe a few words, to the LTC 3.0. The Progressive Political Party introduced the 3.0 version just last year. Mainly, still extending the coverage to more people. And also here, what's specific about this plan was to also strengthen the link between the healthcare and LTC. So now it's trying to integrate low service capacities existing both in healthcare service and the LTC. And finally, the LTC 3.0 formally recognized the contribution of the foreign migrant workers, as I mentioned, in the system design. Because the government now realize, with such a fast pace of population aging, service provision by the public sector cannot really keep pace with the very fast increasing care need. Okay, so the final slide about Taiwan. Next. So during the policy making of the LTC, what characterizes the Taiwanese type is that it's a very pluralist and consultative decision making. As I mentioned, yes, NGOs and also a lot of experts working or collaborating with the NGOs in Taiwan have very actively participated in the policy making jointly, with the both ruling and also the major parties, and that's why the foreign examples such as the Nordic model or the Japanese idea of the community care have really come into being also in the Taiwanese LTC model. And so what I would like to say about the major characteristics in policymaking process of LTC in Taiwan is that yes, a close collaboration between the political parties and the NGOs, and therefore it's not just the political elites, just like the mainland China that has been so predominant, but also a lot of voices from the civic organizations. And so, yeah, this is about the Taiwanese case. And I'll just give the floor again to Jack for Hong Kong.
Okay, I will carry on to talk about the last case. Before I talk about the case in Hong Kong, it's very interesting to remind everybody here that the model across these three places are slightly different. The one in Taiwan, it is the ruling party claim that it is universal tax funded. Okay, despite the fact that it is not that universal, but basically you can say that it is modeling the Nordic model on how to provide long-term care. The one in China is quite Japan, Korea, German model. That is social insurance to reimburse the cost of long-term care services. And however, the one in Hong Kong, well, it is tricky that if you just look at how the government finances it, it is tax funded, but it is not that universal. It is not because the government exclude to exclude the wealthy, the middle class. Is because the middle class, they themselves opt for the markets. Okay, so I will explain to you that how we end up in this situation in the past 7 decades after the Second World War. So we all know that after the Second World War, that Hong Kong can carry on to be the British colony. So basically, that two types of migrants, well, we can call them migrants, came to Hong Kong from mainland China. Those who are, well, we can say that they are legal to migrate to Hong Kong, and normally with money, they're professional, they're rich, and many of them actually with how to say that, with mates, okay, Chinese mates, and those illegal aliens at that time, the so-called illegal aliens at that time, they were actually refugees escaping the war before 1950, and after 1950, escaping from all kind of cultural revolution, that kind of political struggles, came to Hong Kong. So they were working class people. So eventually, these young and middle-aged migrants, no matter legal or illegal, came to Hong Kong for the first 3 decades between 1950 to 1970. They were gradually entering their old age from 1980s. And many of the mates that the professional, the rich people brought with them to Hong Kong were also entering their retirement age as well. So the Hong Kong government actually established a mechanism allowing the middle class, the rich people, to hire Philippine nannies since 1980s. So the system actually, there is a path dependency over there. So the rich, the middle class, they always look for support from the market. However, how to deal with those poor people, how to deal with those working class people, so that was a problem. So for the first 3 decades after the Second World War, those working class people were actually looking after themselves by the family. Okay, so the family support them, and the government only play a role as the humanitarian last resort safety net, these kind of things. Okay, from 1980s, however, the number, well, given the fact that the life expectancy increased rapidly in Hong Kong, and Hong Kong now is the the city in the whole world with the highest life expectancy. So the Hong Kong government need to figure out how to tackle this crisis, because more and more people need long-term care since 1980s. So they started to finance beds provided by the private sector, the private nursing home, the beds in the private sector. Well, I mean, they try to make good use of them. So the procedure is very simple. The working class elderly who suffer from disability, they can apply to the government, and after a long queue, and then they will be arranged a bed in the private care home, and the government finance that. They don't need to pay for that. Okay, so this is a system quite similar to the one you could see in the UK. Well, given the fact that before 1997, Hong Kong was a colony of the British Empire. Right, okay, that was what we can see before 1997. Actually, during the same period of time, the Hong Kong government introduced the residential care home ordinance, standardized the quality and the government schemes, integrate private providers into subsidized care. Well, they were actually expanding the market role. So, Daniel, could I go to the next slide, please? Right, okay, so in the past quarter century, given the fact that the integration of Hong Kong to mainland China was developing, there was a more and more integrated into mainland China. So, and more people entering their retirement age, long life. It is not enough to just subsidize beds in private nursing home to accommodate the working class disabled elderly. So, and a very important reason is the Hong Kong government try not to establish public institutional care themselves. They do not want to operate that, because that would mean that they could not sell all the land to the markets to make profit. They have to appropriate some land for this kind of facilities. They just didn't want to do that. Well, to be fair, if they wanted to do that, perhaps they need to consult Beijing for permission. Right, okay, so they introduced a new initiative that is aging in place. They want to promote more home care and more community care, so that to keep the elderly in where they live, so they do not consume more beds from the private nursing home. The government just finance more money on community care and home care. That was what we can see in the past more than 2 decades. So during this process, more and more NGOs from the third sector, many of them are actually from religious background, the Roman Catholic and the English Church. Well, many of them operate by these religious groups. They provide care to those people stay at home. This is the development of aging in place in Hong Kong. However, the Hong Kong government restrained its expansion on spending, on public spending on this area. As a result, the capacity of home care and community care was, well, far behind the demand, the rising demand of the people who is enjoying the highest life expectancy in the world. So the latest development is this, that the central government in Beijing, they try to demonstrate they're very kind to the Hong Kong people. So they coordinate the Hong Kong government with the neighboring Guangdong government to establish a few, not establish, but to how to say that, to coordinate a long list of nursing homes in the neighboring Pearl River Delta, 24 or 25 nursing homes with the Hong Kong government. So if the disabled working class elderly, they are happy with that, they can move to the mainland side and then apply for a bed in those mainland nursing homes subsidized by the Hong Kong government. This is the latest development. However, this development is heavily criticized by many NGO in the first sector in Hong Kong, saying that, well, I mean, you should resolve the problem locally by appropriating more land in Hong Kong rather than pushing the elderly across the border to China, because there is a critical issue here. All the elderly went to mainland China for a bed in those private nursing homes. They would find it very difficult to go back to Hong Kong to see doctors in those public hospitals in Hong Kong. They need to find a way to finance their medical bills in mainland China. So this is the controversy we are seeing now. So I would like to summarize the. Can we go to the next slide, please, Daniel? I would like to summarize the policy-making characteristics in a polity like Hong Kong. We can call it a hybrid one. So we can see three very important key features here. The first one is this is quite administrative-led governance. I mean, Hong Kong is famous for its administrative-led governance, well, on all aspects of public policy. I mean, we can also see that as well in terms of LTC reform. It is the government dominating the policy in 1980s and 1990s on subsidizing private beds, and then in the last 2 decades on promoting aging in place, and the latest development in the past 5 years talking more about to push the elderly go back to mainland China to take a bed over there subsidized by the Hong Kong government. So it is quite administrative-led. This is a very important feature. The second one is the gradually, but not immediately, gradually increasing influence from Beijing. That in the past, that Beijing tried not to instruct the Hong Kong government on how to deal with this kind of. I mean, this is social issues. Beijing care more about political issues and economic issues rather than social issues. But in the past 5 years, they try to influence social issues. And that's why you can see the central government's coordination on those nursing homes in the neighboring Pearl River Delta with the government in Hong Kong. This is the second key feature, I would say. And the last thing is the influence of the third sector, particularly those religious service providers. Well, traditionally, they play a very important role, not only in care provision in Hong Kong, but also in policy making, because that for the administrative-led governance model in Hong Kong, they consult the so-called experts from the trade. They establish committee to consult experts of the trade, and many of these top NGO guys, they sit in those committee, those panels, they offer advice to the government. This was the case before 1997 and was also the case to some extent for the first 30 years after 1997. However, in the past few years, this kind of influence has been declining, especially in the past 5 years. So we can see that they are not being able to how to say that they're not being able to influence the direction. Well, they could never dictate the decision, but they try to influence the decision, the directions of the policy making in the past few decades. But in the past 5 years, you can see that they can only offer advice, but whether or not to take their advice, or whether or not to at least to show respect to their advice, it depends on which one is in charge of the Hong Kong government. So their influence is declining, I would say that, in terms of policy making, but they are still very important, most importantly, in providing care. So that was the case in Hong Kong. I will pass it back to you, Daniel, to summarize the three cases. Thank you.
Thank you very much, Jack. So I will try to go fast because we have been talking for a long time, but these are complex cases, and there are different aspects to this that we have discussed. Of course, the difference between the different types of political regime and institutions, but there are also a story about existing policy legacies, especially in terms of the public-private dichotomy in Hong Kong and Taiwan mainly. lesson drawing from other countries, and also territorial governance, so level of centralization, decentralization, and so forth. So it's a complex story. But if we focus on the topic of these seminars and on the special issue we are involved in, the special issue project we are involved in, it's clear that you clearly have, first of all, different paths in terms of long-term care development in these countries, in terms of in terms of the policy outcomes, if you want, urban and worker-centered approach in mainland China, a universalistic approach in Taiwan, and a residualist approach focusing on lower-income people in Hong Kong. I don't know why now I cannot click the slides forward. What's up? Yeah. This is really strange. Here. Okay, I will stop sharing here and just read the I don't know what. Trying to get out of this here and then read my notes. Okay, yes. So the conclusion here is that political institutions really matter in determining the logic of redistribution, the logic of the social policies in the context of social policy expansion, in this case regarding long-term care. You have certainly some level of path dependency in terms of how China and Hong Kong feature really a centralized decision making that limits innovation, even if in China, mainland China, there is decentralization in terms of policy implementation. You have strong in a democracy like Taiwan, you have strong involvement, participation of NGOs that really stimulates innovation in the policy design of long-term care. You have less involvement of these the civil society actors in Hong Kong, and of course, almost none in mainland China. In mainland China, the logic is really driven by bureaucrats and the incentives that they have. For example, Jack mentioned mayors who want to please their political masters and so forth, and they don't focus on so much on the public. I mean, they are not elected, right? So you have a bureaucratic logic that's very important. Bureaucracy is important in the two other cases, but of course there is some, I would say, counterweight in terms of the role of civil society actors, which is especially clear in Taiwan. So right now you have these three systems are going in three different directions, and certainly the Taiwan, the democratic system there allows for this kind of universalistic social policy expansion. When we look at China, you have social policy expansion in specific areas, the countries, and through a logic of experiments, right? Pilot projects, and which is a key characteristic of the China's authoritarian system. And then you have this hybrid polity, this semi-authoritarian system in Hong Kong, where you have basically a reinforcement of the status quo in terms of regionalism that is continuing, and you also see in Hong Kong, with the decline in, I would say, democratic life, a growing influence of the central government of Beijing, as Jack said. And so I think that it's probably the case that it's a bit paradoxical. That's where you see the most change in terms of the nature of the political system, and at the same time where you see possibly the highest level of continuity, I think, in terms of the self-reinforcement of this logic of residualism over time. So it's been a long presentation, so sorry for that. I hope it was not too technical, but again, when you start to look at these issues of, authoritarianism, democratic backsliding, and democracy, and you work on social policy, you have actually to look at the specific policy legacies. You have to look at how the policies actually work and how they change over time on the ground. You cannot just make generalizations about democracy and authoritarianism without looking at specific programs and how they work and how they change in a more detailed way. It's very hard to do in a short paper. Our paper is rather incomplete, the paper we circulated, but I think we added some layers, we have complexity to this presentation, and we'll include some of this in the next draft of the paper. And at this point, we look forward for your comments, suggestions, and questions, which are likely to help us to improve the paper moving forward. Thank you very much.